Hi, good evening. How are
Hi-
you?
I'm good, sir. Thank you for joining. We're just waiting for our next speaker, and
Good.
as soon as he joins, we'll start with the show.
Sure.
Hello, Dr. Pratyush Ranjan. Thank you for joining. Let us start with the show now. Hello, and welcome to all in yet another IHW Twitter space. Integrated Health and Wellbeing Council is India's leading health forum, working towards creating awareness and advocacy for all. This is Dr. Asavri Sawant, public health specialist, and I would be moderating today's Twitter space. 1st to 7th April is recognized as Blindness Prevention Week. And this year's theme of Blindness Prevention Week, given by WHO together with International Agency for the Prevention of Blindness and other non-government organizations, is the right to sight. As we all know that eyes are one of the most sensitive and delicate organs of human body. But unfortunately, with the increasing pollution, extended screen times, growing stress and other external factors, eye diseases are a common problem affecting several individuals. While some eye problems cause little to no harm to an individual suffering from them, some other eye problems can severely impair vision and may even lead to blindness if untreated. So today with us we have two expert ophthalmologists here with us today who are who are going to talk on the topic proper nutrition for your healthy vision. Please allow me to welcome Dr. Devakant Mishra, who's the director of Swarn Jyoti Eye Hospital and head of retina services at Swarn Jyoti Eye Hospital, Lucknow. I welcome you to the show, sir.
Thank you so much. The pleasure is mine. Yeah.
Thank you. We also welcome Dr. Pratyush Ranjan, who is cataract, refractive, and glaucoma specialist at ASG Eye Hospital, Varanasi. Sir, welcome to the show.
Thank you, Dr. Aswari Sawan. Thank you very much for inviting me.
Thank you so much. So, let us start with proper nutrition and discussing the same for healthy vision. So, my first question is to Dr. Pratyush Ranjan. Sir, can you please touch upon what is the nutrition that is important to keep in mind for young and adult patients both who have refractive errors and are wearing spectacles in general?
Dr. Aswari, I hope I'm pronouncing it right. If I'm not right, please
Sir,
correct
it's
me.
Asavri.
Uh, Asawari, yeah, okay.
Ji.
So, Dr. Asawari, the latest guidelines say that there is no nutritional supplements or higher doses of normal vitamins which can alter the refractive error. So right now the consensus is that this myopia epidemic, the minus number which our kids are wearing a lot these days, in just around 25 years back, we used to have a situation where one or two students in the class used to be wearing glasses. Now the scenes is almost reversed. So the main cause of this is high screen time and lack of physical activity, especially in daylight. The sunlight should fall into your eyes. So these are the only two things which can alter the refractive error, which can alter the progression of it. Uh, Unfortunately, the carrot hawks, which has been propagated for a quite long time, has no advantage in this. The carrot hawks, I hope everyone here present knows about it. It was a it was a propaganda thing started by Britishers during World War II when they acquired the airborne radar system, and they wanted to fool the Germans that how they are able to visualize their fighter planes in the night. So they said they are eating a lot of carrots. That's why their vision are so good in the night. And the this propaganda was, started at the highest level of the government. So even the prime minister of then, he did a public announcement through the radio that everyone should eat carrot and farmers should grow carrot, and that's how truckloads of carrot started moving in the army cantonments in Britain, and that becomes a hoax, become a kind of thing for every parent feeding their kid with carrot, a lot of carrot. It's not helping. It's not helping at all. So no overfeeding of carrot, a balanced diet, a good nutritional balanced diet, lots of leafy green vegetables, at least 2 to 3 portions of fruits, and minimum.
So we lost your network over there. Are you able to hear us? Okay, so till we have Dr. Pratyush back with us, let us discuss on another question that we have for Dr. Divakant. Sir, can you please highlight how important a healthy retina is and maintaining good health of that, and what are the ways that people should, adopt in their everyday lifestyle to keep their eyes healthy for as long as possible, even when they reach older age? Over to you, sir.
Thank you so much. And some really interesting points Dr. Pratyush was covering. Hopefully, we'll have him back soon. There are certain, see, a lot of people are aware of the refractive errors, myopia, the cataract. Everybody knows about that. But the eye problems, which are restricted, which are limited to the retina, there is very less awareness these days to that. So we need to understand there are probably two main diseases that we need to be concerned when we are talking in terms of nutrition. Number one is something that is known as age related macular degeneration, and the other thing is diabetic retinopathy. So, a lot of people know about diabetic retinopathy because India is now the diabetes capital of the world, also. But age related macular degeneration, people have very less knowledge about. This is one of the things, one of the diseases which has been directly linked to nutrition. So we need to understand when a lot of studies were done and we were trying to find out why this is happening, why the retina of older people is getting damaged. So then it was found that there are a lot of nutritional deficiencies that are being correlated to that. So number one, there are certain things that we need to understand that has to be there in our nutrition. Number one is something that is known as the carotenoid pigments, which are lutein and zeaxanthin. So a lot of us might not have heard these words. These are certain pigments which have a lot of work in the retina, and one of them is helping in blocking the UV rays and the light of the blue spectrum. So it prevents damage to the retina as well as it has got some antioxidant properties. So this can lead to the deficiency of this can lead to age-related macular degeneration, and it can be easily found in certain green leafy vegetables like palak, kale. Apart from that, certain other things like green and yellow capsicum, papaya, mangoes, and not that much in carrot. Second thing is consumption of zinc. Now, this is another antioxidant which is very commonly seen in kidney beans, chickpeas, legume-based diets. So, zinc is very commonly present in that. And whenever we take zinc, then there is the absorption of copper is decreased. So, usually we take copper along with it when you are having zinc. Apart from that, three main vitamins are there. That is A, C, and E. These are very good antioxidant properties and help in keeping our retina healthy. And all of us know these are widely available in citrus fruits and similar things. Apart from these, omega-3 fatty acids are very important for the retina, which is found less in the vegetarian diet, and it is more commonly available in the non-vegetarian diet. Now, keeping all of these things in mind, a lot of supplements have been developed which are readily available. Most of them are over the counter, they are available for eye health, and we prescribe them very regularly. And number one, it helps in preventing this macular degeneration from happening. And number two, if the person already has macular degeneration, it at times helps us in its progression also. So apart from that, there are certain lifestyle changes that should be there. That absolutely smoking is contraindicated in such patients. There are certain things that you need to look at is like the family history. If there is a family history running in the, if there is macular degeneration running in the family, then we need to take care of that. Another thing is wearing of dark glasses, preventing our eyes from UV rays. And the second thing that was about diabetic retinopathy. So we need to, of course, we need to keep our sugar level in
So
control.
we will come back to diabetic retinopathy in the next question with you.
Okay, sure, sure.
I believe doctor is here with us, Dr. Pratyush. Sir, is your audio working well now?
I think he has joined as a listener.
No, no, he is a speaker, but I believe there is some network issue with Dr. Pratyush. So till the back end team fixes that, we'll take the next question with Dr. Devakant only. So, sir, as you were sharing that two of the main, as India is has become the diabetic capital of the world, which is unfortunate, but many people are now suffering from diabetic retinopathy. So there are so many listeners that are not from a medical background. So for them, can you please explain in short what diabetic retinopathy is? What are the first signs that they should be aware of if they were to develop this problem, and what should be the common, the best method to go about it, who to consult, and within how much time, and what lifestyle changes are suggested for such people? Over to
Right.
you.
Thank you, doctor. This is a very, very important question. And we all, whether we are doctors, we are physicians, whatever our profession, we need to be aware of diabetic retinopathy in great detail these days. So now we are seeing very young diabetics with very aggressive retinopathy these days, which is leading to a lot of vision loss very quickly. So let us understand this disease a bit better. Uh, I'll not go too much into the pathophysiology and stuff. The number one thing is that if you are a diabetic, whenever you are diagnosed, now the earlier there were guidelines like you can get your eyes checked in 1 year or 3 years or 5 years. Now all that has gone out of the window. Whenever you are diagnosed as a diabetic, an eye exam, not just an eye exam, it is known as a dilated eye exam. So, where certain drops need to be put inside your eyes and your retina needs to be examined, preferably by a retina specialist. If a retina specialist is not available, an ophthalmologist or a general ophthalmologist can also help you with that. So, get an eye exam done as soon as a diagnosis is made. If it is found that you do not have any diabetic retinopathy, good news, but at least on a 6 monthly basis, get these examinations done. So you need to be in touch with a good ophthalmologist, somebody who can do a thorough retinal or fundus examination for you. So number one thing is that. So every six at the time of diagnosis and probably every 6 months, you need to get an eye exam done. This is the most important thing which will catch the disease at a very early stage. And of course, it will make you aware. And any intervention that needs to be done at the appropriate time, it will lead to prevent further vision loss. Now, number two thing is what are the signs that you can look for? Number one would be vision loss. If you are having any blurring of vision, it can be due to other reasons that is related to diabetes, like there are certain lens changes that happen in lenticular changes that might lead to vision loss. But most probably, if you are facing vision loss and if you are a diabetic, it is most probably due to diabetic retinopathy. Number two, if you're seeing certain black spots in front of the eyes, that means that the diabetes has progressed to a very advanced stage and now there is bleeding that is happening inside the eye. So you will see the bleeding as small black dots inside the eye in your visual field. And if the bleeding progresses further, then there can be complete blindness for a certain amount of time as well. So if these are the symptoms that you are having, then you need to immediately go to a retina specialist or an ophthalmologist to get you checked. Now, there are various forms of treatment. Number one is, of course, prevention of diabetic retinopathy from happening, which happens, number one, by sugar control. And we need to understand there are certain other factors like hemoglobin, your cholesterol levels, your kidney profile, your vitamin D profile. These are also the things that you should keep in check all the time as a diabetic. Now, in terms of diagnosis of the disease, the test that we do on an annual basis or a 6 monthly basis for all our diabetics is a fundus photography, where we take photographs of the retina. It is good for documentation and also for explaining to the patient how the disease is progressing or how the disease is under control. And there's another thing which is known as OCT, ocular coherence tomography, which is in rough words like a CT scan of the retina, which will help in diagnosing the disease further. And at times, if there is bleeding, we might need to do ultrasound of the eye as well. And coming to the forms of treatment that I was talking about, number one would be prevention. And there are two or three more types of treatment. One is in terms of injections, which are known as intravitreal injections. They help in reducing the edema or the vision loss that is happening. And then there are certain lasers which are done either to reduce the edema that is happening or preventing the disease from progressing to a further stage. And last, and at times now we have to do that very often, is surgery for diabetes, which is done in case of vitreous hemorrhage if there's a lot of bleeding that has happened inside the eye and it needs to be removed physically. And other thing is what we call as retinal detachment, tractional kind of retinal detachment that happens due to diabetes. These are the indications for surgical intervention in these cases.
Thank you so much, sir, for highlighting that. So, we have Dr. Pratyush back with us, and Dr. Pratyush was highlighting the very interesting carrot hooks that got developed, and he also highlighted that additional and excessive supplements or food for correcting refractive error is still being researched upon. So, there is no need to over supplement your body or your kids for correcting their refractive errors. So, sir, as we were on the topic of diabetic retinopathy, cataract is also one disease that so many people in India develop very early on if they have diabetes, and mostly if they do not have diabetes, occurs to them in their old age. So, can you please highlight that? What are the early signs of a cataract, and how can people incorporate lifestyle changes so that they do not contract this sort of condition in when they progress in age? Over to you.
Hi, Dr. Shavri. Sorry, I was disconnected before. Uh, Cataract is the most common cause of blindness in the world and in the India. According to the latest blindness survey, it is 62% of our population is having blindness due to cataract. And till now, the accepted technique of treatment is in the initial stages, patient wear glasses and he can see a little better. And after a certain stage of cataract, the glasses would not work, and then that patient would require surgery. So, any dietary supplement till now has not been proven to kind of skip surgery. So, there is nothing that you can skip right now with any kind of dietary modifications. But yes, a good healthy diet with normal doses of antioxidants uh, can prolong your the progression of cataract. So some research have shown that uh, if you take antioxidants in regular doses, you can prolong it by maybe 5 to 6 years, but it will not go away, and only the speed of progression is being slowed. The progression is still happening. So that is the story with the cataract and nutrition right now. The most common cause is obviously the oxidative stress, and these oxidative stress results from various factors. Diabetes is one of them. Age-related changes is the second one, and around 80 years of age, most around 70% of uh, people will have cataract. So with that kind of figure, we are having around 300 million people affected by diabetes mellitus, and this number is going to be around 450 or 500, if I remember correctly, by 2030. And in a similar way, the aging population above 60 is around 2 billion by 2050. So we are having a big population which is going to be diabetic and old, and these two groups will require surgery. And unfortunately, like we have seen in Corona, hospitals become overwhelmed. Suddenly, you don't have beds. Suddenly, you don't have oxygen, and suddenly you don't have ICUs. And similarly, with such diabetic and old age population coming up, you will not have so many surgeons and the requirements for surgery at that given time. So it's really wise to have adopt a healthy lifestyle so that it can be a little prolonged. And if you little prolong it, then probably things become more easily manageable surgically also. So, but unfortunately,
We lost you,
chemical
sir.
vitamins have shown no
Yes.
role. Like there are many studies in with vitamin, none has very effective in reducing the cataract or uh, kind of diminishing its effects. And in fact, high doses of vitamin A has shown to increase it. That's a very interesting finding. If you take high dose of vitamin A, your cataract seems to progress faster, and you seem to develop blindness quickly. So some people they think that having vitamin A will bring back the vision. It will actually accelerate the process. So that's very interesting and important thing to consider. Uh, for cataract, it's very important you have a normal balanced diet, some age appropriate multivitamins you can take, normal doses of antioxidants, not the mega doses which many on the internet are kind of propagating. So that's it.
Thank you so much, Dr. Pratyush, for making us aware on that aspect, that it is very essential if you are developing any early signs of these conditions highlighted, to consult your ophthalmologist or a general practitioner. First and foremost, consult some eye specialist, and do not try to self medicate or use medications over the counter for any of the eye conditions, as eye is such a delicate organ. We advise that you consult a specialist as early as possible if you're developing any early signs. Another aspect that people suffer from the most is dry eyes because of increasing pollution and increasing hot global warming and hot weather. So Dr. Pratyush, can you also touch upon that? If what is the dry eye syndrome, who is more prone to it, and what lifestyle changes or added changes can need to be incorporated to cope up with this condition?
Dry eye syndrome is coming up in a big way because of our lifestyle changes with lot of screen in it. So a lot of screen will lead to digital eye strain, and digital eye strain is a known for inducing three things. So the other name for digital eye strain is computer vision syndrome. So syndrome always means three or more than three diseases. So first disease is dry eye, second disease is convergence weakness, and third disease is your neck and back pain. So constant bad posture will lead to spondylitis and lower back pain. So dry eye results because of digital screen in the productive age group. The young kids during pandemic, they got hooked to internet, and now their parents are also unable to take them off, because during pandemic they only force them to study on laptops or phones. So now it is difficult for them to switch them to outside outdoor activities. Secondly, the jobs, the software professionals, they are on most of their waking hours, they are on screen, either on the laptop or in the uh, phones most of the time, even during the night. So these are the two main age groups which are affected. And then comes the elderly age group. So after certain age, generally it's 65, we consider 60, 65, when you starts having diminution of the basal tear glands. The basal tear, there are two tears in the eye. One is basal tear and other is reflex tears. So basal tear is the tear which keeps your eye moist, which comes with every blink and which goes with every blink. There is a very elaborate system in the eye which controls all this. So the brain controls the blink. With every blink from three different glands, the three different layers of basal tear will come. The mucus will come from the conjunctiva, the lipid will come from the lids, and the water will come from the lacrimal gland, and they will arrange themselves in according to the physics of it. The oil will float on the top, the mucus will go just over the eye, and the water in between. So this structure gives you as a lubrication. This structure cleans your eye every minute 16 times or more. The other the other tier is reflex tier, and that is only salt and water. So whenever you have a lot of dry eye, the brain will start producing more of reflex tears. So you will also have tearings. This is very important. That paradox, this is called dry eye paradox. When you have tearing and your eyes are dry. So this age group, the elderly age group, this basal tear starts decreasing, and especially after menopause, the females tend to have this more. So in that age group, if you have another risk factors like thyroid or screen time or a lot of AC, if you are sitting in front of air conditioner all the time, especially on your face, uh, if you're traveling and having this air conditioner on your face, so these all things add to it, and you will have more of the symptoms of dry eye. So for dry eye, there are certain modifiable risk factors like screen time, your AC, your screen uses, some drugs which can be causes for this dry eye. And then there are certain things which you cannot modify. So like your thyroid status, your age, your gender. So especially with kids and software professionals, this curtailing of their screen time is very important, and that can only reduce the dry eye symptoms, not the drugs alone.
Thank you
Yes,
so
over to
much.
you, Ashwara.
Thank you so much, sir. With that, we come to the end of a very interesting session with Dr. Devikant and Dr. Pratyush. Before parting, this is my last question to both of the panelists. As we are in the Blindness Prevention Week currently, what would be your one advice to all the listeners hearing this show to keep their eyes in the best of health? What tips you would want to share? So let us start with Dr. Devakant. Sir.
Hi. Again, thank you for such an interesting session. It's great to be part of this awareness program. And one single tip which I had also mentioned when I was speaking is all diabetics make it a point to get your eyes checked if you haven't gotten it checked till now. And remember the keyword, that is a dilated eye exam with the help of your nearest ophthalmologist. Thank you.
Thank you, sir. Dr. Pratyush, your tips.
My tip would be to have a healthy lifestyle, lots of fruits in your diet, lots of physical exercise, stay away from screen, and have a comprehensive eye examination, as we call it, dilated eye examination, the another name is. And three ages are very susceptible for many diseases, and we generally advise that at this age, you must get a comprehensive eye examination. That is age 4, when kid starts going to school. At that time, they must get a thorough comprehensive eye examination, a dilated eye examination. Then at the age of 40 years, that time the adults start having a near problem, so they will eventually go to doctor. So doctor must do a comprehensive eye examination. The patient must ask for a comprehensive eye examination. The patient must not deny the comprehensive eye examination. And then at the age of 60, so, and 60 onwards, every 2 years is recommended. And if you are having any problems, as my friend Dr. Divakant said, if you are having diabetes, hypertension, any other issues of eye, then you have to do it regularly, as your doctor suggests, and mostly it's annual. So, healthy diet, good exercise, less of screen, and regular follow with doctors. So it's not one, it's four. One is not enough to keep your eye healthy.
Amazing, sir. So, thank you so much. That was Dr. Devakant Mishra and Dr. Pratyush Ranjan with us today, with at a very interesting session on prevention of blindness for the Blindness Prevention Week. Thank you so much to both our esteemed panelists for taking out time from their busy schedule and joining us for imparting wealth of knowledge and information with all our listeners. Thank you so much. I would also like to thank all our listeners for staying with us till the very end. This is Dr. Savri Sawant signing off for today, and stay tuned for more episodes this entire week on blindness prevention. Thank you so much.
Thank you, everyone. Have a blessed